The term sanitarium, sanatorium, and psychiatric hospital have a long and complex history that is intertwined with the evolution of medical care and societal attitudes towards mental health. Sanitariums, in particular, were originally designed to provide care for individuals suffering from tuberculosis, a disease that was widespread and often fatal in the late 19th and early 20th centuries. These facilities were envisioned as a retreat from urban life, where patients could receive fresh air, rest, and specialized treatment in a clean and sanitary environment. Sanitariums began to appear in the United States and Europe during this time, often located in rural areas with ample open space and fresh air. These facilities typically featured large, well-ventilated wards, private rooms with balconies, and extensive grounds for patients to exercise and socialize. The architecture of sanitariums often reflected their function, with buildings designed to maximize natural light and ventilation. Over time, sanitariums began to treat other respiratory diseases, as well as conditions like asthma and bronchitis. However, it was not until the mid-20th century that mental health began to be considered a significant aspect of overall health, leading to the development of psychiatric hospitals and sanatoriums specifically dedicated to treating mental illness. These facilities were designed to provide patients with a secure and supportive environment where they could receive specialized care, including therapy, medication, and rehabilitation services. By the 1950s and 1960s, there was a growing recognition that mental health care should be provided in less institutionalized settings, such as community clinics and outpatient treatment centers. This shift in approach was driven by a number of factors, including advancements in medical treatments, changes in societal attitudes towards mental illness, and a desire to reduce the stigma associated with institutionalization. As a result, many psychiatric hospitals and sanitariums began to close their doors or downsize significantly during this time. The 1990s marked a particularly significant period of change for the mental health care industry. In the United States, the passage of the Omnibus Budget Reconciliation Act of 1986 led to the deinstitutionalization of thousands of patients with mental illness, who were transferred from psychiatric hospitals to community-based settings. This trend continued throughout the 1990s, with many states closing down large mental health facilities and reducing the number of available beds in remaining institutions. The closings of psychiatric hospitals and sanitariums during this time were met with both praise and criticism. Supporters of deinstitutionalization argued that community-based care was more humane, effective, and cost-efficient than institutionalization. They also pointed to the inhumane conditions and abuses that had occurred in some psychiatric hospitals, such as overcrowding, inadequate staffing, and the use of restraints and electroshock therapy. Critics of deinstitutionalization, however, argued that the closings left many patients without access to necessary care and treatment. They pointed to studies showing that many patients released from psychiatric hospitals struggled to maintain their stability and often ended up homeless. In incarcerated, or rehospitalized. In response to these concerns, some jurisdictions have worked to develop support systems and community-based programs to help these vulnerable individuals transition to life outside of institutions. In conclusion, the terms sanitarium, sanatorium, and psychiatric hospital have evolved over time to reflect changing medical practices and societal attitudes towards health and illness. The mass closings of these institutions during the 1990s were a significant milestone in the history of mental health care, reflecting a shift towards community-based treatment and deinstitutionalization. While this transition has brought about both benefits and challenges, it has ultimately helped to improve the lives of countless individuals living with mental illness.